So welcome everyone on today's webinar where we will be presenting an advocacy and communication handbook on young people and contraceptive access. This was scheduled to happen during our annual general membership meeting in Dakar, but as we could not wait for you to give any feedback, we wanted to present it with you this way. So we will start today with me giving an overview of the handbook and its chapters. And afterwards, Sadia Rahman from Serak, Bangladesh will share experiences from a key message workshop during the second Bangladesh Youth Conference on family planning. And afterwards, there will be plenty of time to answer all your questions. Full disclosure, I made this presentation for a session that was going to take over around an hour, and now I'm going to have to try and push it through in 30 minutes. So I'll try to go over everything as clear as possible and not ramble along the way. So most of you might know this, but over the course of earlier this year, we have developed the Youth Caucus Key Messages, which are 18 recommendations to tackle the barriers young people face when accessing affordable and quality reproductive health supplies. And this handbook is to support and use the key messages for in-country, regional, or even international advocacy. So the handbook that you might have seen attached to the invitation for this webinar contains 3 chapters. The first chapter answers the question why we think that young people need a specific focus as compared to all people with an unmet need, and also how this fits within the strategic structure of the coalition, being its 4 pillars: availability, quality, equity, and choice. The second chapter of the handbook features a series of tools that, when followed correctly, will help you to translate the key messages, which are, in any sense, global recommendations to be used for in-country or regional advocacy purposes. And the third chapter is something that we added, is about do's and don'ts for online communication about reproductive health topics and addressing adolescents, and also features a series of best practices that we came across and innovative ways of advocating and reaching young people. So to begin, so why are young people a special case? So when we started with our youth-centered focus and formalized the Youth Caucus, there were 2 questions that we wanted to answer. So why do young people need specific attention compared to all people with an unmet need? And how can the work of our work on adolescents be linked to the coalition strategic pillars? So the first statement that I kind of want to address is that when you look at different reports, it's clear that young women face a significant higher burden of unmet need for contraception. A Guttmacher report on 31 developing countries indicates that women between the age of 15 and 24 years face an unmet need of 31% compared to only 23% when women are aged between 24 and 49 years. There are a few reasons we can think about for this gap that are all situated under our 4 pillars. For example, financial dependence for out-of-pocket payments, stigma surrounding premarital sex and provider bias towards young people, age-based restrictions on accessing reproductive health supplies, and the lack of quality comprehensive sexual education, which result in misconceptions about contraceptive and contraceptive use. So addressing these specific barriers young people face are vital to bridge the gap and work towards reaching universal health coverage goals and bring young people to the same level of access on quality health supplies as all women. So within the limited research we found on youth and sexual reproductive health, there are some studies that try to explain this unmet need gap for adolescents and how it relates to accessing reproductive health supplies. The first is our age-based restrictions, and there are two types of age-based restrictions, ranging from legal restrictions like parental consent laws or age restriction to accessing emergency contraceptives or age restrictions on sexual activity, to more societal restrictions based on a lack of knowledge on whether or not providing a certain contraceptive or certain service is legal, or based on the personal belief and system and opinions of providers, which, for example, is shown by studies in Nigeria, Kenya, India, Tanzania, and Ghana. The second thing that we found is that when looking at the contraceptive method mix, and this is an indication of the level of use of different contraceptive methods, and at the coalition we strive for a broad method mix because that suggests that the population has access to a range of different contraceptive methods, and by contrast a method mix that is dominated by certain types can signal that there are some barriers in the society to accessing a wide range of contraceptive methods. And when comparing the contraceptive method mix of different age groups, the result indicates that young people only use a limited number of contraceptive methods. For example, in the age group 15 to 19, more than 50% of the young people are using either a traditional method or male condoms. And as you can see by the graph, is that especially male condoms dominate the method mix of this group pretty heavily. Another thing that we found is when looking at studies and comparing the contraceptive failure rates of compared with adults, adolescent contraceptive behavior is characterized by shorter periods of consistent use, higher contraceptive failure rates, and a greater likelihood for stopping for reasons other than the desire to become pregnant, which we can guess about, but this can indicate that the methods used are not always the first choice of the young people and that there is a lack of knowledge on how to use or what the correct type of contraceptive method is for their preferences. So moving on to the second question, the RHSC Youth Caucus Key Messages, we tried as much to bring them in line with the general vision and strategy of the coalition, being its 4 pillars. So in order to support our claim, we listed some clear policy asks that are linked to the key messages on the one hand and the Reproductive Health Supplies Coalition pillars on the other hand. And I'm not going to go over them in detail because I don't have the time, but all these asks are based on different youth consultation we organized in Uganda, Indonesia, and Côte d'Ivoire. So moving on to our key messages, I was not able to get them on one screen, and as they are 18, there's way too much to go over. So if you have not seen them, I would urge you to visit our website and look at them. But for the purpose of this presentation, we don't need to go over them all in detail. So these key messages, there are 18 policy asks and recommendations of what young people need globally. So when you are an in-country advocate and working in your country, that might mean that these key messages are not all as relevant to you as they are to somebody else. So we developed a few steps and tools that when you follow them, they will help to tailor the key messages to your specific region or country and help you to get the most out of them and do advocacy on reproductive health supplies in a more effective way. In the handbook, you will see that for each step there is an example available, and that is because for the purpose of practice, I used Uganda as a test state for the tool. to show how someone that is not really working in country can still use the tools and go throughout the steps in an easy way without that you have to perform very thorough and research. But still, just an example to show what the every step entails. So the first step, as you can see, is gathering data on your region. So what does this mean? It means that you kind of need to get an idea of how people in the country you selected are using contraceptives, what are their needs. So I looked at the demographic and health survey for Uganda and found that there are over 1 million young people aged between 15 and 19 that are currently sexually active, and that their behavior is characterized by low contraceptive use, only 70%, and that there is a limited method mix, heavily focused on condoms and injectables, as also indicated earlier by the graph in the previous slides. And that the stated reasons for not using the contraceptive methods are mainly negative, from almost 30% saying that there is fear for side effects or health concerns, to when in union, almost 1 in 3 people saying that the others are opposed to using a contraceptive. The second step that I did is that I looked at numerous national policy documents on sexual and reproductive health services. And luckily for me, I could use the Public Reference Bureau Family Planning Scorecard as a starting point. For those who don't know the policy tool or were not part of the webinar that we hosted a few months earlier, this tool uses users to quickly assess the extent to which a country's policy environment enables and supports youth access to and the use of family planning throughout the promotion of an evidence-based practices. So for me it was a very easy tool to kind of start looking at what policy documents are out there in Uganda and what are positive points and what are lacking points. This is a really easy tool. I included the link in the presentation. And to be clear, it's the Population Reference Bureau Family Planning Scorecard. So I identified some main takeaways. For example, that there are laws and policies that support youth access to family planning services regardless of age, but it does not include provision of a full range of methods, which creates a gray area that allows for providers to apply restrictions on personal beliefs and on adolescent sexuality. Comprehensive sexual education is limited, and policy promotes abstinence-only education or discourages sexual education, which the exclusion of critical sexual education materials suggests that the policy environment creates a barrier to youth accessing reproductive health services, and that youth-friendly services do not offer a wide range of contraception, resulting in a high unmet need in Uganda. So the unmet need for Uganda ranges from 31 to 35% for girls aged 25 to 15 to 24. So with that in mind, I moved on to the next tool, which is selecting a focal key message. So by answering a series of questions, you will be able to establish how important a message is in your context and whether or not your organization is the best stakeholder to take this forward. You see an example for key message 1, empowering young people by giving them accurate, youth-friendly and age-appropriate information on SRH methods and how to find trusted health facilities. So I filled in the questions, and at the end you kind of get to rank how important you find this message. And I tested a few messages and I found this the most important. So all the other tools will be starting with working further on this message. So the next step is to identify target policymakers. So this means that you have to figure out which policymakers are crucial to target for addressing young people's reproductive health and the specific message you selected. So again, there is a series of questions that will help you to map policymakers in your area based on their influence, attitude, and affiliation with either youth and access to reproductive health supplies. And you see an example for the Ministry of Health, but something I want to point out is that's an obvious policymaker when it comes to this key message, but an often overlooked group of policymakers are, for example, parliamentary groups. Parliamentary groups are people in the parliament who get together to kind of focus on specific issues that are often not as clear-cut as ministerial offices. For example, you have parliamentary groups on adolescents or on women's rights, etc. And they always prove to be very vital partners because they have a more direct line to official government officials, and they have more influence on setting the political agenda than a civil society organization often might have. So when you have identified your policymaker, you can move on to the next step, and that is to find the best way to communicate your message to your audience in order to have the best possible impact. Because not every policymaker has the same interest in a topic. Like we will probably, after the previous step, have identified 3 or 4 different policymakers, and this tool will help you to better tailor your message to your policymaker by identifying the main concern or interest of your target policymakers. For example, it might be easier to gain support from the Ministry of Financing if you use a cost efficiency approach instead of a human rights framework. By pointing out the gains that you can have from investing in youth-friendly information, you will be able to get more support from them than when you focus on a human rights framework. So after you have done that, then you have your specific message for your specific policymaker, and we can move on to the next step, and that is to analyze the policymaking process and identify advocacy opportunities. So there are many ways to influencing the decision-making process, and this requires analyzing that process and identify essential windows of opportunity where you are more likely to get attention for your selected key messages. This is really important because, like a window of opportunity, it can be an election, an international summit, or just a high visibility moment. For example, we will see further along that for my key message, I have selected the start of the school year because one of our activities was going to work with schools to promote visibility on our topic. So that is also a window of opportunity. And understanding the decision-making process will help you to find out in what way you can influence decision makers. For example, if there is a formal space for civil society organizations to be consulted on specific laws, that also allows you to gain access to the decision-making process. So at the end of this, there is again a set of questions that will help you to identify some winnable opportunities. So if you can then again write down 3 moments that are going to be crucial to include in your action plan, then you are ready to move on to the next step. And the next step is to develop an action plan. So after you've gathered all the relevant information and have some advocacy opportunity in mind, You can develop an action plan which will specify which actions need to be taken towards specific policymakers and put a clear timeline. So you can see that my activity is to hold workshops, to engage peers, to educate young people about youth-friendly services for reproductive health, and recruit adolescents to become champions on youth-friendly services in their community. And this activity I chose is based on the Uganda Family Planning Cost Implementation Plan of 2015-2020, where there is a similar activity included. So then it's time to select some indicators, to select your partners involved, and for your timeline, you need to write down the windows of opportunity moments that we wrote down earlier. So I selected the start of the school year, which is in February in Uganda, if my research is correct, and the National Family Planning Meeting, which took place a few months ago in September. So then you have two window of opportunities that are separated by a specific time, which is always great when you have a program cycle. And then the last set of tools that we kind of put in our handbook is a tool to monitor and a tool to evaluate your program, because once you finally start with the cool stuff, it's still very important to follow up on your progress so that all parties involved are held accountable for their part in the action plan. So at different moments in your program cycle, you should review everything and answer a series of questions we've included. For example, which of your targets are you reaching? Are you falling behind on any targets? Are your indicators still representative? Are there new activities that you could include that will help your progress move on further, etc., etc. So most of these things are pretty clear-cut and for most people pretty known, but we still kind of include everything because we want to make a well-rounded set of tools. So the final is an evaluation tool, because it's always important to analyze your final results and compare this with what you set out to do. And this will help to determine next steps, provide recommendations for future actions based on lessons learned. So we included the following questions: what did not work well and what should be, what was a disappointment, what worked well and should be continued in the future, and what new activities could help achieve your goals and objectives. So at the end of the day, we think that if you follow all these steps, you should have a clear understanding of how to use the key messages in the most effective way for in-country advocacy and activities. We try to develop this to be easy to understand and not too difficult to use. So there are, of course, more complex models for monitoring and evaluation, for addressing policymakers, about indicators. But we kind of gave always a basic overview of what we think that should be included, and always reference to places where you could find more information on these different steps. Before we move to chapter 3, I'm just going to take a quick breath. So the final chapter of the handbook is about do's and don'ts for online communication regarding reproductive health topics and addressing adolescents, because we kind of wanted to give also some tips and tricks for when you develop activities, and most of these activities, or a lot of activities, are these days feature in the online space. It also provides an overview of best practices of innovative way for advocating and for reaching and addressing young people. And these best practices, we can see 4 examples on the slides. It ranges from applications to virtual reality projects to comics books to to a lot of different things, to an interactive website they built in 15 different languages in Belgium to educate newcomers on sexual and reproductive health practices and places they can go to in Belgium. So I would advise you to definitely take a look if you want to get a good idea or a tip on something that you could do. There are all really good examples of best practices. Some of them have been chosen multiple times to speak at international conferences. For example, the Donde is an open source platform that helps users locate quality youth-friendly services in Argentina. We also did a webinar on that you can see on our website in English and in Spanish. So all very interesting best practices. I'm going to go quickly over the tips and tricks because, well, you can see everything more in detail in the handbook. But some of the tricks to engage effectively online with young people are about overcoming online barriers, language barriers, cultural barriers, which places it's good to see what role models young people are interested in, good examples of how you can communicate a positive sex message, etc. There are examples of great visual tools, which types of images you can use. Actually all the best tips and tricks from our communication teams are in there. So before we move on to the question part, I would like to invite Sadia Rahman from Siraj, Bangladesh, who organized a workshop on the key messages during the second Bangladesh Youth Conference on Family Planning. So I will give the floor to her.
Thank you, David. Hello, everyone. I'm Sadia Rahman. I work for Siraj, Bangladesh. Siraj, Bangladesh has co-hosted Bangladesh's second National Youth Conference on Family Planning with IYAFP in partnership with Bangladesh, PPD, RHRN. On the second day of the conference, Siraj Bangladesh facilitated a workshop on how to do advocacy with advocacy key messages with around 35 participants, aged 16 to 28 years. So participants were divided into two groups after going through all 18 key messages. Two of the group chose two key messages, which is number 1 and 6. After finishing the exercise, two of the groups presented their works. And after the workshop, we conducted a small study on their feedbacks on workshop, and there are some feedbacks that the tool was quite critical for the youth participants, as they were aged between 16 to 28, and as all of you know that the tool requires a study on regional situations, so they weren't prepared that much, and they were the workshop was 1.5 hour long, and they said the time wasn't that much appropriate to conduct this exercise, and so participants needed more time to finish, and they gave some recommendations that the tool can be more attractive, that they felt the tool is quite monotonous, and there are just things like is just the addressing the issues, and they said the tool can be more attractive and easier, so the young people can feel more interest, and language of the tool can be more easier, that there were languages like indicators and other the PNL. So they were familiar with this type of words, so the language can be more easier, and participants actually would like to be engaged more, that they really enjoyed the practice, and they enjoyed giving their opinion, and it was a good practice of the tool. They are saying if we can arrange a 2 days workshop on with this tool, and they can on the first day they can uh, just study on the situation of their region or country, and then on the second day they can briefly practice the tool. So this was a good practice of the tool. Benefit of practicing it among young people is they can put their opinions, and there were many interesting ideas were coming when practicing this tool. So it was a really good one. So that was all about the workshop we have done in Bangladesh Second National Conference. Thank you. I will just give it to David to continue further.
Yes, so thank you, Sadia, for for hosting the first Key Messages workshop and for providing us with some feedback. So the next step that we kind of want for this handbook is that it's a draft, and we kind of want input from all Youth Caucus members on how we can improve this handbook, especially the tools, because as you heard from the feedback from Sadia, we are somewhere in between making it as easy to use as possible for young people, but on the other hand also giving developing something comprehensive for people working in the field on reproductive health supplies for young people that already kind of have a basis of this. So in the coming weeks, we would like to provide you with the opportunity to go over the handbook, kind of send us your feedback, remarks, everything that could help for us to improve this handbook before we move on to finalize it and present a final draft by the end of this year or beginning next year. So I know it was a lot in a short time, but we kind of did that to allow for some questions, remarks on the handbook, or anything else that you want to say. So if you have a question, you can raise your hand or post a question in the question box so that I can unmute you and give you the floor. So if anyone has any questions. Jennifer, yes, go ahead, and you can unmute yourself. Jennifer, you have muted yourself, so I cannot unmute you.
Can you hear me now?
Yes, go ahead.
Yes, I think Sadia's presentation is very they were able to highlight certain recommendations that need to be put in place into the handbook, like stating the fact that the allocated time was not enough. That means more time is required. to use the book in a certain workshop. And I really kind of appreciate that aspect in allocating more time for it, because if we need to really do a robust analysis, we need some time.
Yes, okay, so I can answer that by saying that the tool can serve two purposes. So the first purpose is that if you are a youth organization or an organization working on reproductive health access and young people in, for example, in Jennifer's case in Nigeria, this tool will help you that if you are developing your work plan or thinking about projects or activities, you can say, we look at the key messages document and we see one of the key messages that we find really important. We can use this to develop a set of activities or a project based on the tool. So that doesn't mean that can take more hours, it can take days, but this tool will help you to do that. And on the other hand, if you want to do a workshop, I think you need to look at the all the different tool set, and like Sadia said, the tool might be too comprehensive to finish in, like, if you have a session of an hour. So then you kind of need to, for example, what Sadia now did is that she prepared already information on adolescents sexual and reproductive health access in Bangladesh, so that is a first step that people don't have to do. So I think that when you give a workshop based on the key messages, you can kind of slim down the tool to what you find the most important. And for example, don't start with the first step where people get all the key messages and see like that they have to select out of the 18 what they found more important, but you can already do like a pre-selection and say, these are the 3 key messages we want to work with today, etc., etc. So I think when it comes to organizing workshops, it's kind of up to you to decide, or when you ask our help, we can always work together to kind of decide what is the best format to use for the time that you have. So I see that there is another question. So yes, Sahat Hassan, you can unmute yourself. Hello? Okay, I think he. Okay, if it's not possible to post your question, to ask your question via mic, you can always post your question. So it's better to write your question if you're not able to speak. So is there anybody else that has a question in awaiting of Sahat's written question? I see a question from Milka asking the handbook will also be made available in French and Spanish. I would say ideally yes, because we really want it to be for youth-led organizations in Africa and in Latin America, all across the world. But at the moment it's only in English, and we will kind of need to look at options on how to translate it. But I think the first step is to kind of have a final version in English, and I really hope that we can work further and also have a version in French and English, in French and Spanish. I think that would be ideal and also really fits the purpose of this handbook. So does anybody else have a question? If not, I would really like to thank you for participating and listening to this pretty fast through presentation of the handbook. Ideally, it would be great if you could review the handbook in your own time and kind of point out some of the the slacks and kind of where you think we can work to improve it, because we really want the feedback of all people, young people working in the field, working with young people, especially on how you can improve the handbook. I will send around the handbook to everyone on the Youth Caucus listserv, and we will also place it online. But before we kind of make it official, we will like to get your feedback and work on it a little bit more. But I will be sure to make it available to everyone, and if you have a question, you can always send me or email me, of course. So I have a final question from Sahat. He would like to know how you can implement this handbook in countries like Pakistan. Well, yeah, I think what your question is referring to the core of this handbook, being that this handbook will help you to implement the key messages in Pakistan if you go over all the different steps. So you should start with making a country profile of Pakistan, and if you go in the handbook under the first step, gathering information, you will see a list of international agreements you can look up if your country kind of signed them. There are tools to review the policy environment in your country, all different information on where you can find information on your country. And if you did that, then you can just start with the different steps, and by the end of the last step, we hope that you have made a work plan that is implementable in Pakistan and tailors to the needs of adolescents in Pakistan. And like I said, if you have interest to develop a work plan based on the key messages document, you can always ask for our help and support in doing that, or if you're organizing a workshop. My email address and the email address of Emily Peters, who I'm currently replacing, are at the bottom of the handbook, so you can always ask for our help and advice. So if there are no other questions, I would like to thank Sadia for giving the thorough overview and feedback recommendations from the first key message workshop, and I would like to thank everyone for joining and for their future inputs on the key messages handbook. So also thank you to Hannah and Lucian from the Health Supplies Coalition, who worked with the layout and the multiple times of reviewing the document. So thank you everyone, have a good day, and I look forward to seeing all types of feedback on the document.